Cervical and breast cancers, according to authorities, are deadly diseases that have continued to claim several lives, particularly in low and middle income countries, and that most of these cases particularly target teenage age brackets. This informed the campaign by the Onyabuchi Chris ArOY Foundation to raise early awareness, particularly among secondary school children, to help them adapt positive attitudes and preventive behaviors that will prolong their lives.
Our focus is not just to create some awareness and leave it midway. We want to see how this can be mainstreamed or entrenched into the curriculum of schools so that teaching can be sustained.
During the campaign, the students were taught on possible ways of checking their breast and other safe practices. Leaders of the group observed that school children are targets due to their vulnerability and advocated the inclusion of cancer detection teaching in the school curriculum for sustained awareness.
We are here to educate the young ones the need to know about this cervical and breast cancer. The ArOY Youth Campaign that we are doing here today is to catch them young, our young female children, for them to know how deadly these cancers are, especially the cervical and breast cancer.
Manager of the whole school, Mrs. Akuwa Victoria, and other participating students lauded the initiatives.
I understand that there's an app that has been built and is actually user-friendly for their age range.
From the little time we spent here, I've come to a conclusion that breast and cervical cancer should be escorted out of the country.
And before, I never knew that cervical cancer can be transmitted through sex. But today, I learned that it can be transmitted through sex, and they also say that men also have breast cancer. I thought it were only girls and women that were victims of breast cancer.
The campaign is to be carried out in other schools for more impacts. From Gboko local government area, Sandra Doisi Akeme, NTA News.